This is a quick review of patients with myasthenia gravis. The nerve communicates with the muscles by releasing chemicals called neurotransmitters, which fit precisely into receptor sites on the muscle cells. In myasthenia gravis, the immune system produces antibodies that block or destroy many of the muscle's receptor sites for a neurotransmitter called acetylcholine. When fewer receptor sites are available, the muscles receive fewer nerve signals, which results in weakness. It's believed that the thymus gland, a part of the immune system located in the upper chest beneath the breastbone, may trigger or maintain the production of these antibodies. In some adults with myasthenia gravis, the thymus is abnormally large. Some people also have tumors of the thymus. Usually, the thymus gland tumors are non-cancerous. Some factors may make myasthenia gravis work, like fatigue, illness, stress, and extreme heat, as well as some medications, such as beta blockers, calcium channel blockers, and quinine. Initial symptoms of myasthenia gravis may include difficulty speaking, dysarthria, difficulty swallowing, dysphagia, drooping eyelids, ptosis, and double vision, diplopia. Patients often have nasal-sounding speech and weak neck muscles that give the head a tendency to fall forward or fall backwards. These symptoms occur in about 90% of myasthenia gravis patients and are usually intermittent. They just come and go, and may disappear for weeks and then reoccur. Pregnancy can improve, worsen, or have little effect on myasthenia. Frequently, symptoms first occur during pregnancy or after delivery. Muscle weakness caused by myasthenia gravis worsens as the affected muscle is used repeatedly. Since symptoms typically improve with rest, the muscle weakness may come and go. Eye muscles. And more than half of the people that develop myasthenia gravis, their first sign of symptoms involve eye problems, such as ptosis, diplopia, and blurred vision, which can come and go. Speaking may be very soft or sound nasal, depending on which muscles have been affected. Swallowing, the patient may choke very easily and makes it difficult to eat, drink, or take some pills. In some cases, the liquid comes out of the nose. The muscles for chewing may wear out halfway through a meal, particularly if they've been eating something hard to chew, like a steak. Family members may note that the patient has lost their smile if the muscles that control the facial expressions are affected. Myasthenia gravis can cause weakness in the arms and legs, but this usually happens in conjunction with muscle weakness in other parts of the body, like the eyes, the face, or the throat. The disorder usually affects arms more than legs. However, if it affects the legs, it may make them waddle when they walk. Myasthenia crisis is a medical emergency that develops when muscles that control breathing become severely weakened. It may lead to acute respiratory failure, and patients often require a ventilator to assist with breathing during the crisis. Other complications that may develop include choking, food aspiration, and pneumonia. Factors that can trigger complications in patients with myasthenia gravis include viral respiratory infection, surgery, corticosteroid use that is tapered too quickly, overexertion, especially in hot weather, pregnancy, and emotional stress. One of the confusing factors in treating patients with myasthenia gravis is that insufficient medication, the myasthenic crisis, and excessive medication, the cholinergic crisis, can present in a similar way. A cholinergic crisis results when there is an excess of cholinesterase inhibitors like neostigmine, pyridostigmine, or phosphostigmine, and resembles organophosphate poisoning. In this case, excessive acetylcholine stimulation of striated muscles at nicotinic junction produces flaccid muscle paralysis that is clinically indistinguishable from weakness due to myasthenia gravis. A myasthenic crisis or cholinergic crisis may cause bronchospasm with wheezings, respiratory failure, diaphoresis, and cyanosis. Other therapies used to treat myasthenia gravis include plasmapheresis, in which abnormal antibodies are removed from the blood, and high-dose intravenous immunoglobulin, which temporarily modifies the immune system and provides the body with normal antibodies from donated blood. These therapies may be used to help individuals during especially difficult periods of weakness. A thymectomy, which would be surgical removal of the thymus gland, which often is abnormal in myasthenia gravis patients, and reduces symptoms in more than 70% of patients without thymoma, and may cure some individuals, possibly by rebalancing the immune system. Nursing management is emphasizing importance of avoiding contact with individuals with colds or respiratory infection, since these conditions could be devastating to a myasthenic patient. Patients may be placed in intensive care unit for continuous monitoring of their respiratory status. They may require endotracheal intubation and mechanical ventilation. If the patient is at risk for aspiration because of weak swallowing muscles or a poor gag reflex, it is important to closely monitor their eating and swallowing patterns. Position the patient on their side to drain pulmonary secretions and regularly auscultate for breath sounds. In addition, use chest physiotherapy and coughing exercises. Support the patient's fluid and nutritional needs and give continued psychological support during crisis period, as the patient is usually still alert. Instruct the patient to inform their dentist of myasthenia condition, since Novocaine is usually poorly tolerated. Instruct the patient to rest at frequent intervals and avoid fatigue. Try to determine which muscle groups are affected by weakness. Establish a baseline muscle strength on each side of the body, and the weakness seen with myasthenia gravis is usually not symmetrical, and reassess that strength at least every hour. To prevent muscle atrophy, have the patient do active range of motion exercises. If the patient is too weak, perform passive range of motion. Monitor exertion levels and cluster nursing activities to avoid fatiguing the patient. If possible, ADL should be performed after the patient has had a good night's sleep when they are the strongest. Throughout the day, they should be provided rest periods between activities. Teach patients about potential side effects of their drugs. In addition, be sure to review the factors that can exacerbate symptoms of myasthenia gravis, including emotional stress, infection, temperature extremes, menstruation, and extensive exposure to ultraviolet light. Advise the patients to wear a medical alert bracelet that identifies them as having myasthenia gravis, and carrying a card that has information regarding their medications and primary care physician. Instruct them to call their physician if weakness develops or facial or upper eyelid drooping occurs, as it could be an exacerbation of symptoms. Suggest to the patient that they wear good shoes to combat muscle fatigue and potential loss of balance. Encourage them to eat regular balanced meals to prevent fatigue from lack of protein. They may need to adjust their eating routine, so they eat when they have good muscle strength, to take their time eating and rest between bites. More frequent, smaller meals may be easier to handle. Also try soft foods and avoid sticky foods that require lots of chewing. Whether newly diagnosed or just diagnosed after a crisis, patients should be instructed to take their medication as prescribed, and to take it early enough when eating or engaging in activities to obtain maximum relief when it's needed most. For example, patients on pyridostigmine who have trouble chewing or swallowing should take the drug 1 to 2 hours before meals. Safety precautions at home include installing grab bars or railing in places where they may need support, like next to the bathtub. Keep the floors and halls in the house clear of clutter, cords, and loose rugs. Outside the home, keep the steps, sidewalk, and path to the car clear. Use electronic appliances and power tools. Saving energy in the bathroom and in the kitchen or in the workbench by using electrical appliances like toothbrushes, can openers, and screwdrivers. An eye patch can be used if they have double vision, and the patch can be used while they read or watch television. To avoid eye strain, periodically switch the patch from one eye to another. Planning. If they have a chore to do around the house, or shopping to do, or an errand to run, plan the activity to coincide with the time of which their medication provides their peak energy level. If they're working on a project at home, gather everything they need for the job at one time to eliminate extra trips that may drain their energy. Ask for help. Depending on the energy level, they may not be able to do everything they have planned around the house or run every errand they need to. So it's important to be able to ask family members and friends to lend a hand. The quality of life of a patient with myasthenia gravis can be dramatically improved with proper education and medical management.